Dzień dobry. Can you hear me well?
Yes, you hear us, even in Polish. Okay. Good to see you, Louise.
Good to see you as well, here, and thank you so much for your invitation.
We are here in Warsaw with some people on place, some people are online like you. So we see you, that's good connection. So please take us to the journey of digital health in France, because your standards are really, really interesting for us.
Thank you so much for the invitation, and I'm really sorry I couldn't make it to Warsaw this morning. Actually, we had a lot of meetings in France this week, and it wasn't possible for me to travel, but it won't prevent us from learning from digital health, the journey we took in France, and hopefully there's something you can get from that experience, and I'm looking forward also to discussing with you to learn also from you. So let me guide you through the presentation I'm going to give today by starting off with a few words on the former roadmap that we put in place and also guiding you through the new roadmap of digital health in France. I'm going to give you some insight on some new perspectives and initiatives that we launched in France, for example, a fast-track mechanism for early access to digital medical devices. I'm going to speak about Genius, where, by the way, Poland also now has a page for digital health, so thanks for that collaboration. And I'm going to say a few other words that we do at the European level. But first of all, to let you know something very encouraging, France was one of the last countries in terms of digital health. Really had so much work to do to implement new progress in digital health, and we made it happen through a very ambitious roadmap. And that was the previous one that you can see on the slide, which was the roadmap for 2019 to 2022, announced by our former Minister of Health, Agnès Buzyn, and it was basically a real political will to put in place digital health in France. As I said, we were one of the last ones. And this roadmap, which contained 5 orientations and 26 actions, was implemented at the national level. Knowing that in France, we're quite centralized state, and so that it was important for us also to involve very much the regions into this, and to also conduct what we called Tour de France, just as the cyclists do. Our former delegates for digital health went all over France to discuss the need, to express what the goals were, but also to get to know the local realities and the expectations that local actors would have. So that's really important that we did that, so that the strategy was able to be accepted also at the national level through that method. So let me guide you now through the new roadmap. So we learned a lot from the 3 years of implementation of the previous one. And so we just launched in May this year the new roadmap for 2023 to 2027. And the good news is that the English version of it is now also available. I put the link on the presentation that you will be able to access right after. So you can read a little bit more about the details of this roadmap. But basically, it is the continuation of the previous one. It is based on the standards that we put out already in the first one, which is ethics, interoperability, and security. And it's really the core values of our development. And this is just a continuation of the journey that has already done through the first 3 years. Now, why do we always use this kind of house? And the house is now different than the house of the first roadmap, because it now also has a very strong basement, because we were able to really establish those standards that I just mentioned, and a few clouds showing that we really reach out to the ecosystem. And we really have this identity of state as a platform model, where we work closely with private sector actors, but we still promote a strong state-based framework for digital health development that private actors can work with if they wish to, but we do it collaboratively, and we want to prevent that there's 2 systems in parallel, a public and a private system, through that we work closely together with the private sector, but still setting the guidelines and a strong framework so that patients and citizens overall trust digital health and work with us to make it happen and to continue to improve healthcare in France thanks to that. So there's now 4 main pillars of this new roadmap, which has those 4 pillars, 18 priorities, and 65 objectives. So we will be a little bit busy over the next 3 to 4 years. Still in mind, prevention. Our ministry is called Ministry of Health and Prevention currently. So prevention is really in the focus of our current minister. Patient care, to improve access to patient care, but also to health care, and always, as we did before, the supportive framework is really important with the different standards that we promote. Now, we don't do this alone in the Ministry of Health. We're about 40 experts working in the Ministry of Health. There's lots of agencies that support us in this development. So we are on the left, the Digital Health Delegation, directly reporting to the Minister of Health, but we also have a national Digital Health Agency, which counts about 200 experts and who really support the technical aspects of the implementation of digital health, including the standards and interoperability and security frameworks. The National Health Insurance Fund is also a very important actor, especially with regards to the electronic patient record, which is co-deployed with the National Health Insurance Fund. In France, we are lucky in the perspective that almost all of French citizens are in the same fund, which allows to get interesting data collection as well, which is on the right, which is the Health Data Hub, the National Data Initiative, which allows access, secondary use of health data and access to health data for public policy and for research projects of public interest. So all of this is a continuum and all of these actors work closely together, but not without the regions. As you can see in the lower part of the slide, the regional health agencies in France, we have 18, work closely with us together to make this digital health development also a reality at the regional level, together also with the support groups for e-health, which are called GRAD, which are specific entities created specifically for the deployment of digital health and also have the technical skills to make it happen. And so obviously not without the other actors of the ecosystem, including patients, including the hospitals, the healthcare professionals, and all other actors of the private ecosystem as well. So we try to really address ourselves to everyone. Now, this is the timeline of digital health deployment. Always important to keep in mind that there are strong roadmaps, which has started with the first one I mentioned and now currently the one for 2023 to 2027. And this doesn't happen without funding, obviously. So we have a digital component, which was part of the EU relaunch program, which is called Ségur de la Santé, which is funded by 2 billion, which basically enabled us to make this step forward with regards to digital health implementation and also with the sharing, secure and safe sharing of health data across healthcare professionals and the upgrading of their software, which is basically the goal of this program, which is about to be deployed. There's graphs that there's a transparency page which shows with graphs how much documents are actually being digitized and shared across healthcare professionals. That's being updated almost, I think it's daily updated, but every month you can see the curve changes and improves with regards to the digitalization of documentation and exchange of health data. We also have Paris Santé Campus in France, which is our campus bringing together the academic, private and institutional actors, quite dynamic, as you can imagine, because they're all sitting at the same place and making up new ideas and working together, but just basically working there at the same place. So it's a quite nice place. If you ever come to Paris, reach out so you can take a look at this campus in Paris. For digital health innovation, we have launched in 2021 the Digital Health Acceleration Strategy, which is part of our national relaunch initiative called France 2030, which seeks to support digital health entrepreneurs throughout their journey up to the market and to make sure that their solutions reach the patients. So it's important that you have these initiatives in mind, that it's not just the political will, but also translated through funding programs so that these theories, not just the main policies, but also become practice. Now, this is Mon Espace Santé. This is our electronic health record that I just mentioned. We do have experience with a previous one, which is called the DMP, which was actually a failure. So it didn't really work. We couldn't make it adopt. That was actually, way before we had Mon Espace Santé implemented. We learned those lessons from the past. And now, since 2022, actually, Mon Espace Santé has been nationalized. So all French citizens have an account and have access to it. I mean, now we're incrementing the use of it, obviously in practice, so that more and more French citizens are using Mon Espace Santé and that it becomes a daily tool to support healthcare of all ages and across the whole country. Now, those are the 4 components of the Mon Espace Santé digital health space. So there's the medical record, obviously, where you can see all the different documents which you can add as a patient, but also your healthcare professionals can add into the space. So you can get everything at once collected instead of having papers and so on. You can digitalize everything and put it on there. There's also a health calendar where you can see your appointments. There's a secure messaging system between healthcare professionals and even yourself. So that's quite important to avoid that healthcare professionals communicate via WhatsApp or via email, which is not very secure. And here you have a double secure access. So it's really very safe and secure for healthcare professionals to exchange messages here. And there's a catalog of services, and that goes into what I said with the state as a platform model, because the catalog basically contains specific customized offers for patients. So for example, if you have a condition such as diabetes or so, you can get a specific application on the App Store to track your condition, for example. And this is what we call a catalog. So basically the private actors, startups, companies, and so on have to apply through a certification process to be part of this catalog. And they have to go through audits and so on. So it's a very strict process, again, on those values of ethics, security, and interoperability. So we make sure that it's a compliant catalog, and so that these services are also secure and that the state kind of, can put them in this national catalog as well. But it shows that we cannot do all of that as a state. It's very specific sometimes what's offered in there. And so we leave it to the private sector to innovate and to propose those solutions and put them in the catalog. So that's really something we're very proud of, because it's better and better in terms of deployment. This is what I said before on this slide here. The funding program Ségur. Ségur is actually the name of the street just outside of the Ministry of Health. And this is this 2 billion funding program to strengthen the deployment of digital health. So this is still unfortunately in French, but just shows the sectors where this program is working. So basically here for labs, for example, exchanging the data with the patients and with the pharmacies, the community-based doctors, and so on. But it also includes the social care sector. That's really important because that's the sector which lags kind of still behind in terms of digitalization. And so we really provided an important component of this program to the social care sector, which includes nursing homes, any types of social care settings which are not just purely health. And at the core, obviously, the patient is always at the core of these initiatives between the exchange of health data. Now that I've brought a little bit of general elements to you, I want to be more specific and present you the new Fast Track program for digital medical devices, because it's quite new and gets quite much attention, and it might also be interesting for you as institutional, academic, and private actors. So this is part of the 700 million digital health acceleration program that I mentioned to you beforehand. It's an end-to-end program. Basically, it supports entrepreneurs from the development of their protocols, from the lab stage, I would say, up to the large-scale deployment. So there's lots of calls for projects which are dedicated to them, and really at all stages of a digital health project cycle, not just the pre-phase or the phase of development, where you bring it to the market, but also really the large-scale deployment as well. So you make sure that the solution is also adopted and that there's an appropriate environment for it. We also support training of digital health across all actors, especially healthcare professionals in their training curricula. Starting next academic year, there will be mandatory digital health components in healthcare professionals' initial training curricula. And this will also concern some professions which are linked to digital health, but not necessarily healthcare professionals. For example, this can be IT specialists or lawyers in health, for example. They can also get those components if they wish. And this year we're starting a pilot of this, and we hope there's going to be success in it. Obviously next year it will be mandatory, but it's good to already start in a pilot stage this year. So this strategy is specific with regards to the actors that it involves. It's not just the Ministry of Health, but it also involves the Ministry of Economy, the Ministry of Research and Education, and is under the guidance of the Prime Minister's office. But just to tell you, it's nice to have different ministries involved, to have this kind of multidisciplinary approach, and not just be in the health scope, but really to also consider the economy, obviously, the economic aspects and the research aspects to it. We always build our strategies by consulting the ecosystem and by consulting the different actors concerned. So to build the strategy here, for example, we had almost 400 replies to a public consultation. And just as a side note, obviously for the other two roadmaps that I presented to you beforehand, it was also based on public consultation beforehand. And we went all over France to get feedback also for the new strategy. But here, 400 replies, qualitative interviews, and lots of interministerial work to make the strategy and to establish it. And yes, so it's still under deployment, as I said beforehand. And part of it is now the PCAN fast track for digital medical devices. So what is this about? It's not something totally new either. So if you were a digital health entrepreneur, you could access the market beforehand in France. The only difference is it would have been a little bit complex to understand, and it would have taken you much longer. But even before the new fast track came out now in March, which made it operational, there were a few innovations already accessing the market through different venues. For example, the ETAP program, which you can see on the left, that was an experimentation for 5 chronic diseases for remote patient monitoring, had already good results and is now also still under evaluation because the experimentation phase just ended. And now this ETAP program is actually in common law, so it provides a reimbursement framework for remote patient monitoring conditions. And now being part of PCAN, this is an anticipated venue for digital health solutions. So there's 2 different solutions which are in the scope. On the one hand, what we call DTX, digital therapeutics, digital health apps, for example. And on the other hand, also telemonitoring solutions. And both of them have more or less the same method. And I'm going to explain this to you right after. But just to tell you what you see on the upper side of the slide are already innovation initiatives which have been out there since 2015 already. So there were already different venues for entrepreneurs to example organizational impact experimentations and so on. Now, focusing on PCAN, because maybe Poland is also looking at something alike and would like to launch a fast track. It's a little bit different than the DIGA model, but there's still a lot of similarities. The one in Germany, I mean. So what is PCAN? It's a 1-year transitional and also temporary reimbursement access scheme for digital health solutions. As I said, DTX, so digital medical devices for individual use, and on the other hand, remote monitoring solutions. So what we do here is we would like to guarantee a fast access to those solutions for patients, but also to basically explain better the venues, how to access the market, what are the documentation that's necessary, what data you need to submit. And we do this together with 2 bodies, with the National Digital Health Agency that I showed you beforehand, this agency which deploys digital health on the technical part. And we have the HAS, the Haute Autorité de Santé, which is our national health technology assessment body, which evaluates the scientific aspects of it. And it shouldn't take longer than 3 to 4 months after you submit your files, there's 2 actually, until you get a response and that you can access the market, which is quite new to France because usually it took much longer. So again, here as a reminder, the different criteria for accessing the market. You need to come with a CE mark before submitting your file, and you need to show that your solution has the potential to add clinical benefit and or to improve the organization of care. Regarding the level of evidence, you can bring, it's very much recommended to bring preliminary clinical evidence to show those benefits I just mentioned, and real-world evidence here is accepted. So the kind of paradigms have changed a little bit, that new types of evidence are being accepted. The most important thing is whenever you come with your data and the suggested studies you wanna conduct, you need to be as much coherent as possible. And the data where you collect it, for example, it can be in France, it can be elsewhere in Europe, but you need to make sure it's transposable and comparable. So, for example, it could be even useful, or it could make sense to bring data both from Poland and France to this kind of submission, unless it's comparable, unless we think the disease burden, for example, looks more or less alike in those countries, the healthcare systems are comparable, and so on. The other criteria you need to look at is interoperability and security, which is being tested by the Digital Health Agency. So there needs to be compliance with GDPR, with many different cybersecurity standards, and so on. So as I said, it is a 1-year reimbursement scheme with 2 parallel applications happening at the same time to streamline the process. And here, well, it's a little bit a complex scheme, but it shows basically, you can see there's 2 lines here on this slide, 2 lines, which means it happens at the same time. The scientific evaluation and the interoperability evaluation are parallel. So this streamlines and fastens the evaluation process. And yes, after you submit all of your evidence and so on, it shouldn't take longer than 60 days until you get certificates and notices from those two bodies. And then there's a 30-day period for the Ministry of Health to make the decision and to publish the ministerial order where your solution, I mean, obviously, if you are accepted, is listed for reimbursement in the national scheme. So if this is okay for you for the PCON Fast Track, I'm happy to take any questions. All documentation is on Genius, our digital health entrepreneur website, both available in French and in English. You can check out those pages, and actually you as an entrepreneur from the European Union, you're perfectly eligible to propose a solution also to the French market if you are familiar a little bit with French language. Despite the interviews which take place at the National Digital Health Agency and the Health Technology Assessment Agency, they can be conducted in English. The file still needs to be submitted in French. So just for your information, it's still important to have that in mind. Now, why do I think this is important also for you and for Poland? I mean, if you consider to launch a fast track yourself at some point, because at the European level, we're trying to harmonize also the different evaluation criteria for digital medical devices. So this is what we've done since April 2022, because France actually back then had the presidency of the Council of the European Union. And so one of the goals was to foster a European single market for digital health. And so we proposed, as part of this, a task force called for the digital medical device evaluation. And actually it's coordinated by EIT Health, which is a public-private body that supports innovation for digital health, but also for health overall in many different ecosystems. And it's co-coordinated by UNETA, which is the European Network for Health Technology Assessment Bodies. And so we, in France, we were very glad to actually be able to preside this task force, and are still doing it right now. And so this body basically brings together actors from both the private and, from the public and the academic ecosystems. And it has an external advisory board, which is mainly composed of private actors, which challenges the conclusions. But we still remain a quite public academic body with obviously no private interests, because otherwise the conclusions could be skewed, and this is not the goal of such a task force. 3 work packages. In a nutshell, we have a work package on the taxonomy. So we make sure we speak about the same categories. Do we speak about patient-oriented solutions, about professional-oriented digital health solutions? What is the scope, and so on. So there's been work done in work package 1, which is about to be concluded and published very soon. Work package 2 is the most crucial one, because according to those categories that we established in work package 1, we're trying to define what is the minimal evidence that you need to propose your file, and where can we agree upon? Like, what is the same standards? What's different also? So we've been comparing a lot between BfArM, which is a German health technology assessment body for digital medical devices, for DIGA, and the French one with HAS. And the third work package will actually look at the adoption of this. So how can we make sure all of this comes to the market? What are the criteria for the entrepreneurs to come to the market, not just get listed in the ministerial order, but also to access the market? And this includes that doctors are trained, that they know how to prescribe those solutions, and that there's acceptance across citizens also to be able to include this in your daily care, and not just rely on medication-based solutions, but to really diversify the offer of healthcare, to move away from just strictly medication therapy and to move some more orientation towards prevention. And digital health has lots of potential in that. And that being said, yes, so the task force is still quite ongoing. I think there was interest from Poland also to join it, and very happy also to embark you on this adventure as well, if you're seeking on also harmonizing or putting your standards in line with what the European Union does. I mean, the neighbors, first of all, because we're working with the Health Technology Assessment Regulation, which is obviously the European framework, but there's no real space. We don't see the digital medical device collaboration in that text yet. So we're trying to create this kind of parallel venue in collaboration with the tools which the MDR, the HTR, and so on provide. But still, it's important that we have some form of common doctrine across European countries. And I'm finishing my presentation with with actually Genius. Genius is this platform that I mentioned to you beforehand, which explains digital health and the different actors of the ecosystem of digital health, first of all in France, so you can really understand how is it regulated, how is it funded, where you need to go for what product and so on to access the market. The language is quite easy and quite accessible. So we know that digital health entrepreneurs don't have much time, so they need the information quickly and easily, and that's the goal of this platform. And we were very glad during the French EU presidency last year, we actually extended it to a European service. And so now we have 16 country sheets already of European markets which are out there. And the good news is that Poland has already its page, both in French and in English, available, so that entrepreneurs can check the Polish market and also access it, with very interesting facts. I would like to thank very much Professor Katarzyna Kolasa for having so well collaborated with us on this. It's a very beautiful page and still more to come, we hope. And that's all I wanted to say. My Polish is not so good, but I will try. Dziękuję bardzo. Thank you so much for having invited me here this morning, and happy to take any questions.
Thank you, Louisa. It was a wonderful speech. I heard you before. So, well, you are really quick, because PICAN was, for me, was the new project by the Ministry of Health that was organized. So the fast tracks are, as you can see, well organized in Germany, and now they started to be organized in France. Luis, we have some questions from the audience, so be with us just for a few minutes more. Kuba.
So we definitely, thanks for your presentation. First of all, that's always impressive to see how you cope with this digital health data space. My first question maybe is, how the patients are able to transfer this data or give access to data to the doctors when they need it for the primary use. Is it like an opt-in service, opt-out? Do they need to, or if you come to a doctor, do they have access straight away to the previous data of the patient so they can analyze everything?
Thank you. Should I respond directly, or do we take other questions? Let me just go ahead. Thanks for your question. We're still in the beginning of making this a reality. So it's now happening that patients, some of them come with their Mon Espace Santé to their doctors and show, the different documents they have uploaded themselves. You mentioned opt-out, so obviously it's not an obligation. Anyone can opt out of this scheme and not be part of it if one wishes. But the ideal goal of this, the vision of it, is that patients really start to digitalize all the past files that they had. We had also the previous DMP that I mentioned to you, which was not a success, but automatically transferred to the Mon Espace Santé. So there is some track record. So if you connect, you can actually download Mon Espace Santé as a visitor, even in Poland, and get a visitor's access, so you can check out how it's presenting itself. But yes, there's information on your past records, and the goal is that the doctor or the healthcare professional will access it and will see, for example, if there's an emergency, you cannot speak, well, you have the file Mon Espace Santé, you can see what allergies are there, what kind of incompatibilities are there, and so on. So that's more or less the goal, that we all use Mon Espace Santé as a way to collaborate. And it also emancipates the patient, because the patient will know about his previous conditions, future conditions, and can put on information there to control his weight, to control any other factors related to his or her health.
Thank you very much.
Any other questions are there on the audience?
Hello, Łukasz Małecki. I am a physician, but I also represent the digital, let's say, data science private sector. I have a question about the certification. You mentioned about several agencies in Europe, but also your fast track is very fascinating, what you're doing in France. I have a question about the stakeholders. At the end of the day, there are some people doing the certification along to the criteria you've established earlier. My question is, who is among the stakeholders? Is it more academics or doctors, or the representations from the tech companies or startups, etc.? What do you think about that, about organization of this? And my second question is about, you mentioned about the medical devices, and also about I cannot pronounce it in French, so I will in English. This is my health space. This is mon espace santé, or whatever. So I have a question. You also mentioned about some certifications for applications there, which are brought to patient, available to patients. This certification is about the medical devices, but do you also take into account some certification of application or systems which are below the level of medical devices? There are several of them, for example, for self-care, for patients, etc.
Thank you for your question. So on the certification part, if I understand your question correctly, who are the actors involved to actually do the certification process, but not, if not, please correct me. So it is very much managed by the Digital Health Agency for the scope that it tackles, but it also provides lots of interoperability, security guidelines. So obviously we have made it now with the new Social Security funding law, in some instances actually mandatory, and there might even be fees if you don't comply with a set of standards, for example. So on the actors, I don't know if the question is, this is the question you mean, what kinds of experts we put in the in the certification process. So obviously it's a very streamlined process indicated on the Digital Health Agency website. I can send you the link. Who are the actors who certify and how it happens, basically. And on your second question on the scope, basically, of what is actually getting the certificates, or who can actually get the certificates, what types of solutions are in the scope. If you speak about Mon Espace Santé, if you speak about the catalog of services that I mentioned to you, it's basically all types of prevention, monitoring, therapeutic solutions that add up value to patient care, which can be part of the catalog of Mon Espace Santé. But if you mean the PECAN Fast Track that you also mentioned, there's very specific categories. So it's, for example, just DTX for therapeutic purposes, individual use on the one hand, and the other one is for remote patient monitoring. So it's quite a specific scope that you can also check out on the Genius website. So I don't know if I responded to your question, but if parts of it, at least, if not, we can interact after this session by email.